we're just going to dive straight in to find
Yes.
out more about yourself and how was your lifestyle like before you suffered the stroke? Were you
Okay.
like a drinker, very stressed, very working hard? What were your lifestyle like?
Okay. Before my stroke, I don't smoke. My lifestyle is very bad. I play football at least once a week.
Wow.
I am the community member of my car club who organize off-road driving to Malaysia. We volunteer for Stand Chart Marathon every year, and every Friday we have meet up. That is over and above my time doing insurance appointment, coaching, and training.
What were some of the symptoms that you actually experienced before the stroke?
On January the 5th, 2009, I was on the way to early lunch.
Okay.
And I have a afternoon appointment, and I have a hemorrhagic stroke, whereby a blood vessel burst in my brain, and that caused a very I fainted, and that kind of stroke don't have symptoms and don't have reaction time, and most of the time is fatal.
So if I see you now, I can't tell the difference, you know, because I know of some people post-stroke, you can really tell the difference in their facial expression or in like partial of their body being paralyzed. But for you, you're just so normal. How did you do that?
Okay. Mindset is very important.
Mindset?
Yeah.
Okay.
I spent 3 months feeling down, feeling grouchy, bad-tempered. That is 3 months gone to recover. That is, and in stroke recovery, time is crucial. So from walking, shall I say, crawling in the park, covering 10 meters in 3 minutes.
Wow.
That is so super slow, right?
Yeah.
Climbing the Great Wall of China in 5 years later, from a person who almost died to traveling again to go to London and Paris, etc., is all part and parcel of a exciting journey of stroke recovery.
Sorry, did you say you did all these after the stroke?
Yes.
You climbed the Great Wall of China after your stroke?
Yes.
How did you do that? How did you do that?
Determination and positive mindset.
When you say determination, mindset, what was the mindset and what was the determination on your part?
Okay, my mindset is, first, I don't believe I cannot recover from stroke.
So reject the
the
negative, okay?
And everything I try, I will try until I succeed, and no if, no buts.
Or your lifestyle after you had the stroke. What's the biggest change?
Lifestyle-wise, I cannot play football and I cannot play guitar anymore.
Oh, okay.
So I pick up new hobbies like photography. But my most prominent change is my mindset change. That's why I want to share with the audience or the guests 5 pointers. First, for stroke survivor or caregiver, first, focus at what you want to, what you can do and not what you cannot do. Second,
focus on within your new after stroke, what you can do.
Yeah,
okay.
Not what you cannot.
Don't keep thinking last time I play football, last time I can do this, I can do that. Okay. That's a good tip.
Second, learn to decide what is important and what is not important in your life.
So what was the biggest not important thing that was important before?
Okay, last time I so-called fight for principle, fight for pride and ego. Now I will ask myself, is it important? If it is not important, it's not important.
So you now you pick your battles lah, huh? So that you can win the war, right?
Yes.
Yes. Okay. Next tip.
Difficult. The word difficult is just another word. It doesn't mean it cannot be done or it is impossible. It only means you need more time and more effort to get or achieve what you want.
Okay.
And the last 2 points is for healthy people. Please do regular medical checkup, which I didn't. And buy more critical illness coverage as much as your wallet can afford you. That is my 5 main point to really share with the audience.
Well, thank you so much, Mr. Kwek. Thank you. Good evening, Dr. Ravi.
Thanks, Irene. Good evening, everyone. Am I audible?
Yes. Just before you get started, Dr. Ravi, just want to know, like in this COVID situation, what were some of the more pressing situation or issues that you see in today's, in terms of brain? Like, are we cramping too much, thinking too much? Do you get a higher volume of patients coming to see you with migraines? That's a personal question for me.
So COVID actually had resulted into many complications. I'll say the migraine attacks are getting severe. There are many causes. It's not directly COVID related, but I think the stress what people are actually facing nowadays, it's work related stress, it's financial stress. There's so many things. So migraine is one type, but there are other neuro related illnesses also we have seen, and stroke is also one of the commonest thing as COVID. One of the complication of COVID illness is stroke. So we have seen rise in the cases for stroke as well. But luckily, I think Singapore has done well so far, and we have done quite a good number of the vaccination rate is like superb. I'll say Singapore, and we are going to achieve I think a lot more in a couple of next couple of months. So I hope that no more waves in coming months, and then hopefully this year could be the end of COVID also. That's my higher hopes.
Is a sign of second stroke dangerous?
So any kind of stroke is dangerous to begin with. People are lucky if they have first stroke as a mild stroke. That is like a alarm bell, or like a God sign. I'll say that
reminder. Right?
This is the time. This is the time you should take care of your risk factors, follow doctor's advice, and take the treatment as prescribed. So definitely every stroke is high risk.
Okay, we have a record of 30 questions for you, doctor. So do bear with me. The second one is, will a person with no high blood pressure history get stroke?
So if there's no high blood pressure, then if person gets stroke, there should be different causes. There are many causes. So I haven't shared all the medical causes, because if I share, then it will take like whole 1 to 2 hours I need, and there will be a lot of medical terms. But I'll tell you that there are many conditions, genetic factors. There are factors which actually can cause your blood to be more thicker. So we call it pro-thrombotic states. So there could be many. There could be heart-related causes, and there could be other autoimmune causes also which can cause stroke. So once you have stroke, better see a neurologist and then let him actually work up for you so that we can find the cause of the stroke and treat it.
Do you think it's better to call for an ambulance, or if I have my car, to send the person to the hospital myself, since time is of the essence, right?
So if you are, let's say, nearby, I'll say that, let's say you are near to a hospital, definitely you can, go to the emergency department, if let's say within 1 or 2 minutes you can reach there. But I'm talking about in general, the best is actually to call ambulance 995, because time is brain, as I said. And when the ambulance paramedics people will come, they will give some kind of first aid treatment, which is very important. And they will actually notify the stroke team in the emergency department of the hospital. So those people also will be ready. So we want to minimize the time, that means the time taken from a patient's home to the reaching to ED, and then from there onwards, it should be the minimal time loss, so that can give early management of that stroke problem. And early management means a better outcome.
People want to know, like, how long do they have to depend on medicine?
So I think this is a very common question, and especially in young people, because people don't like to take medicine every day. So TIA is called transient ischemic attack, or we call it as warning stroke. That means the clot was there, but before even it could cause permanent damage. Somehow body actually flushed out this clot. Okay. So you had symptoms for, let's say, a few minutes to a few hours, but before even it caused permanent damage, the clot was lysed or clot was flushed out by the body's own system. So basically you are very lucky. Okay. Now, whenever there is a warning stroke, the risk of another stroke is always very high. That means your brain has tendency to have stroke. So it's best how to actually prevent it. And the simplest answer is take one pill a day and you can prevent that major disastrous stroke. So I would say that yes, have to take this medicine for longer term. How long? It depends on, all the advancements going on. At this moment, the best drug is these blood thinners, which you have to take every day. Okay, we don't have an injection you take and then for whole year you don't need to take it.
When it comes to strokes, what percentage would you say is a result of lifestyle factors versus genetics? And if anyone has had a stroke before, what's the percentage chance of them having a second stroke in their lifetime? When a person is observed going into a stroke, is there anything bystanders or family members can do physically to slow down the stroke enhancing before the ambulance arrives?
So when stroke happening, there are things people do usually, like they will massage, or they will try to give something from the mouth, like some people give sugar syrup, thinking that it could be a hypoglycemia. Some people even try to offer water, So I tell you, these are very risky things because when stroke happens, then your swallowing muscles actually go into a paralytic state. So you can't swallow. So whenever you want to try to give some food or water or liquid, whatever, then it can go instead of food pipe, it can go into your water, your windpipe. And this windpipe can actually go all the way to the lung and then can be disastrous for patient. So best is when patient have stroke symptoms, make him lie flat, in a bed or in a safe environment. Sit with him, reassure him, and just call 995. That's the best thing, and try to, reassure him that, help is on the way. That's the most important thing.
Dr. Ravi, thank you so much. I've learned so much from you, and I now need to relook at my stroke exposure.
Thanks, Irene.
Yes,
and I think I will just use this platform to actually send this message to everybody in Singapore that please don't hesitate to take COVID vaccine, because this is also this ongoing problem, which is now we know that the main problem is that this virus is actually ongoing. It may not go completely, but at least we'll have our own, I'll say, as a bulletproof jacket. The vaccine is there. At least I have my protection. I have my family protected. So we have seen in neighboring countries, the situation is worse. We don't want that situation to happen in Singapore. So please follow government guidelines and then take vaccine, okay, as soon as possible.
Thank you so much. Thank you so much, ladies and gentlemen. Dr. Ravi.